Hi everybody, welcome back to my Wednesday video blog series. Today I want to conclude the low back subject. I hope in my past few weeks you have learned something useful for you or for a friend or a family member who might be experiencing low back pain or discomfort. And maybe you can address with a sound plan that will get rid of that pain for good. So today I want to talk about gastrointestinal tract inflammation and low back pain. In other words, if there's a stress in your digestive system, how that relates to your low back. So first, let's talk about nerves, the nerves that feed your lumbar spine, your L1, all the way to your S2, on your sacrum area. All those nerves are the same nerves that control your small intestine. You can see right here, controls your small intestine, your stomach, and also your colon. So if you have any issue on one of those areas, your stomach, your small intestine, or your colon, doing inflammation, you will have something that we call visceral reflex, somatic inhibition. That big word just means that your core muscles, they're also fed by those nerves, might get inhibited. They might get weaker, or inhibition basically means your muscles are not going to be firing at the right time, in the right sequence. And that's what we want when we move our body. When you pick up something from the floor, you want your muscles to contract, to fire at the same time in the right sequence. So if there's any inhibition, your body starts to compensate and you develop muscle imbalances that we see every day. I have it, you have it, and we all have it. It's just a matter of having an exercise program and a lifestyle plan that can correct those muscle imbalances so you don't have pain. So what causes gastrointestinal tract inflammation? Several things. Number one, we all know, stress. Number two, food intolerance or food sensitivity. So I would mention myself as an example. A couple years ago, I decided to eliminate gluten because I learned all about the inflammation factors of gluten, how hybrid, how modified gluten is here in America. So I tried and went gluten-free, and I noticed one thing right away. My low back pain decreased almost to a zero. In fact, I don't have any low back pain now. So I know I have a sensitivity to gluten. To be clear, sensitivity is different than allergy. If you have an allergy or if you're celiac, you cannot have any gluten, or if you're allergic to any type of food, you just don't want to have that at all. But when you're sensitive to certain foods, you might not know right away what's causing the inflammation, so you need to do an elimination diet to figure out what's causing that inflammation, or do allergy test. So another factor is disbiosis. If you have too much of bad bacteria and not enough of the good bacteria, it will cause an inflammation in the gut as well. Fungus and parasites infections that you can test with your doctor if you suspect you have any. Genetically modified foods. Your body doesn't recognize foods that are modified, so that will cause stress on the gastrointestinal tract. Sugar, say no more. Medical drugs, and dehydration. So of course, if you're having any issue in the intestinal digestive area, first place you go, breathing appropriately, drinking water, purified or filtered water, and addressing your diet. Those are the three first places that you go. And if that doesn't resolve the inflammation, then I will start investigating a little deeper with more complex tests. So those are the things that will cause an inflammation in the gut. So again, the sequence would be like this. You have an inflammation, and you have that muscle inhibition, which shuts down the core muscles. And when you shut down the core muscles, your low back and your sacrum become unstable, creating pain, discomfort, tenderness, stiffness, and muscle imbalances. So those are my tips for the day. This concludes the low back series that I did for several weeks. If you missed my video, especially from last week, I'm going to include a link below this post so you can check, because that video from last week talks about stress, which is related to this topic as well. So I hope you enjoyed these videos. If you experience low back pain and if you have any questions, any concern, and you think I might be able to help you, please call me. You can have a 30-minute free consultation with me to see if I can present a plan that will help you to eliminate or decrease your back pain. Or if you're free of low back pain and know anybody in your family or among your friends that can benefit from these videos, please share. Help me to expand the Vitali tribe. I appreciate you very much. Have a great day, and I look forward to seeing you next week.